Thank you, ma'am.
Thank you, Dr. Simi and Sahani sir and the whole Hindi team. Good evening, good afternoon, and good morning. This is the 1902nd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Rachita Tripathi. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in Malayalam, English. And from 9:30 to 10:30, we have the local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again, and you can subscribe the same without paying any money. The purpose of this forum is to take homeopathy to every home around the world. Today, let me come to today's guest. That is Dr. Rachita Tripathi. She has completed her BHMS from Sri Krishna Medical Research Center. Sorry. And she is a consultant at Wellness Center, Community Center in Noida, Delhi, and Sri Krishna Medical Research Center, Delhi. Dr. Rachita Tripathi is practicing classical homeopathy, practicing at Wellness Clinic sector in Delhi, and she has passed out in 2014 from Dr. B.R. Homeopathic Medical College. She has worked with various charitable dispensaries like Lakshmi Narayan Trust and with the ESIC Hospital, Noida, as a part-time homeopathic medical officer from 2018 to 2020. She is a visiting consultant at the Sri Krishna Medical Research Center, Mayur, Bihar, Phase 1, Delhi. She has more than 10 years of clinical experience. She is coming for the first time in this presentation. And today she will be talking about fever, different kind of fever and its management with homeopathy. As you all know, fever is one of the area where homeopathic doctors can strike rich because we have a very good efficient remedies, whatever be the fever, whether it be an acute or a chronic one, or it is a simple viral fever or a bacterial infection after the viral infection. We have homeopathic remedies. Let us see what Dr. Rachita Tripathi has to say. Yes, we proudly welcome you, doctor. Please open your video. You can share also. Already you are the co-host. Is there any network problem with you?
No, sir. Sir, am I audible to you?
You are audible, but the video is not opening.
Yes, I'm seeing it.
Try to open the video first so that everybody can see what. The slides are coming.
Okay. So, says the slides are coming or not?
Yes, it's there in the picture. Okay.
Sir, my video is not coming. I don't know why. So
you just open the video first.
Okay.
Yeah, you can do. You just see the video. Option for video. Just a second. The seconds from the left.
Okay.
Just click on the. You are joined from laptop.
Yes, sir. I'm joining from laptop.
Just simply click on the laptop. You can see the video on the last second left. First side, you can see the audio, then video. Just click on that.
Sir, it's not working, I think.
It may be due to the. Okay. Anyway, you can make it large skin.
Okay, okay.
No problem. Or you can go ahead in this way if you find.
Okay, okay, sir.
Okay.
Uh,
You
Good evening to all seniors, colleagues, and my dear friends. Today I'm going to share my views regarding fever and its different kinds, along 2 or 3 cases where homeopathy works so good in acute cases too. Sir, my slides are visible or not?
slides are visible. You may not
Okay,
be able to see the type,
okay, okay.
but you can simply click on the laptop. So what you are seeing in the laptop is the thing that we can see. Okay.
Oh,
Normal body temperature is the slide now.
okay, okay, sir. Normal body temperature, that is 36 point degrees Celsius or 98 point degree Fahrenheit. What is fever? When the temperature elevate from the normal body temperature, that is more than 37.2 degree. Now, in our brain, there is a hypothalamic center which regulates a normal body temperature. How? By heat production and heat dissipation. Now, heat production from metabolic activity in muscles and liver, and heat dissipation through skin and lungs to maintain a normal body temperature. Now, pathogenesis of fever. Pathogenesis of fever is when this hypothalamic center increases. So, in our periphery, there is vessels that constrict. Vasoconstriction occur. All blood from periphery go to internal organs. Uh, because of this, the patient feels shaky and shivering, and there is increased hepatic thermogenesis. So it increases the body temperature to a new set point. And there is a hormone in our body called prostaglandin E2, which have a similar function like contraction. So it causes myalgia and arthalgias along with fever. Now, when fever goes down, then the vasodilation occurs and sweating. So heat losses. This is the process of fever, is how it heat production and heat loss occurs. Now, what is prostaglandin E2? Prostaglandin A2 is a naturally occurring hormone, and it has a role similar to oxytocin properties, and it helps in initiating labor, mediating inflammation and fever, and regulating vascular tone, promoting tissue repair, and it is synthesized from arachidonic acid by cyclooxygenase enzyme. Now it main functions like vasoconstriction, contraction, and sometime in medicine field it used as a medication. Okay, where there is a condition, congenital condition called patent ductus arteriosus. What is patent ductus arteriosus? Patent ductus arteriosus means to say that before birth, the baby take oxygen from placenta. So temporary fetal blood vessel that connects the aorta to pulmonary artery, allowing blood to bypass the lungs before birth. But after birth, the baby take oxygen from lungs and reduce blood flow that causes ductus arteriosus to constrict in normal babies, in healthy babies, permanently closes within weeks. But if it remains open, it causes patent ductus arteriosus. So in medicine field, this hormone is used as a medication before surgery to keep the ductus open because it constricts. Now, type of fever according to duration, there is acute fever, subacute, and chronic. Acute is self-limiting, that is viral illness, that is for 7 days, 5 days. Subacute is prolonged fever having some infection, chronic infection like TB, autoimmune disorder. And a chronic fever are high temperature fever extended for period lasting more than 3 weeks, like serious undergoing condition, hepatitis B, and like some cancers, leukemias. Now, types of fever according to the temperature pattern. There is continuous fever, intermittent fever, and remittent fever. In continuous fever, mainly seen in UTI, pneumonia, there is 24-hour fever. There is no relaxation period in between, remains elevated. Intermittent fever is seen in cases like malaria, where there is a temperature rises for a short period, then relaxation comes, then again the temperature rises. Now, remittent fever. Remittent fever is like step ladder fashion fever, like in typhoid. The fever body temperature remains elevated throughout the day and increase step by step, but fluctuates ever returning to normal, seen in typhoid fever and bacterial infections. Now, how we approach to a patient of a fever. First of all, history is essential, because history of any travel, history of any pet exposure, sick contacts. Okay, then attention to chronology of events, like how it onset, how its direction, any travel trauma, prosthetic material, and physical examination is important for taking temperature. Now there is a temperature and pulse dissociation. What is going in fever mainly? There is tachycardia. In majority of fever, there is tachycardia, but that is temperature and pulse dissociation. Relative bradycardia, that is called Faget sign, is a clinical finding in some fever like typhoid fever and brucellosis, where pulse rate is not increased. So there is a slow heart rate. Faget sign is a clinical sign in which the pulse rate is slower than the expected for the degree of fever. Normally, for every 1 degree Celsius rise, there is increase in heart rate by 10 beats per minute. 1 degree Celsius rise, there is increase in heart rate 10 beats per minute. But in Faget sign, that is relative bradycardia, that is slow heart rate, like in typhoid fever, Salmonella typhi, yellow fever, flavivirus, and brucellosis, Brucella species, Legionnaire disease, Legionella pneumotyphi, tularemia, Francilla turensis, and leptospirosis, Leptospira enterogens, and Mycoplasma pneumonia, dengue fever, flavivirus. What is the clinical importance of Faget sign? It differentiates typhoid fever with other infection, because in typhoid fever there is relative bradycardia. In other fevers there is tachycardia. So it is useful bedside diagnostic. Then what is typhoid fever? Typhoid fever is caused by Salmonella typhi, that is paratyphi A, B, or C. And there is prolonged fever, abdominal symptom, rose spots on trunk, and it is a gram-negative motile bacillus and transmitted only by human, and through ingestion of food or water that is contaminated, feces, urine, infected persons, and carriers shed their bacteria for months or years. Then incubation period of typhoid fever is 7 to 14 days, range 3 to 60 days. Pathophysiology: bacteria enter through the intestinal mucosa. They multiply in lymphoid tissue of the small intestine, that is Pierce patches. Spread via bloodstream causes bacteremia. Systemic infection leads to ulceration of Pierce patches, causing intestinal bleeding or perforation. Then symptoms of typhoid: prolonged fever and step-ladder type, headache, abdominal pain, loss of appetite, coated tongue, diarrhea, constipation, splenomegaly, rose spots on the abdomen, that is faint salmon-colored rashes. Diagnosis: blood culture positive in first week, then Vidal test after first week, then after stool and urine culture done. Then classification of rashes: centrally distributed maculopapular eruptions, that is viral exanthems and exanthematous drug-induced eruptions. Peripheral eruptions: Rocky Mountain, spotted fever, secondary syphilis, bacterial endocarditis. confluent desquamative erythemas, that is toxic shock syndrome, vasculobular eruption, varicella, and primary uh, HSV infection and erythema gangrenosum. Urticaria-like eruption in the presence of fever, usually due to urticarial vasculitis caused by serum sickness, connective tissue disease, infection, hepatitis B virus, enteroviral or parasite infection or malignancy, nodular eruption, disseminated fungal infection, erythema nodosum, Sweet syndrome, purpuric eruption in meningococcema, in viral hemorrhagic fever, disseminated gonococcema, eruption with ulcers or eschars, rickettsial disease and tularemia, anthrax. Then when to take temperature. Ideally, temperature is taken at rest, not after exercise or eating, drinking hot or cold drinks. Best time morning before eating or evening before bed. Site for taking temperature oral, that is common in adults, axillary armpit, safer in infants and small children, rectal use for infants, and when accurate core temperature is needed. Then types of temperature on basis of causes. Fever of unknown origin, an atypical presentation of a common disease. Most common cause of fever of unknown origin is infections, neoplasm, non-infectious inflammatory diseases, and collagen or rheumatic diseases, vasculitic syndrome, granulomatous disorder. Malignant lymphoma is by far the most common cause of fever of unknown origin. So most common cause of fever of unknown origin is, that is, malignant lymphoma. Then what is familial Mediterranean fever? Is commonly found in Mediterranean descent, is a hereditary autoinflammatory disorder characterized by recurrent episodes of fever. Familial Mediterranean fever, that is found mainly in Mediterranean descent area, and it is a hereditary autoinflammatory disorder. Mainly, there is recurrent episodes of fever, inflammation of serous membrane, and there is a genetic mutation in MEFV gene located on chromosome 16. MEFV gene encodes pyrin, a protein that regulates inflammation. Now, this gene is not present, that encodes pyrin that regulates inflammation. So, in familial Mediterranean fever, defective pyrin leads to uncontrolled inflammation. Inheritance, that is autosomal recessive pattern, commonly occurs in Mediterranean descent, especially Jews, Armenians, Turks, Arabs. Symptoms usually last 1 to 3 days and reoccur at irregular intervals. Common feature of FMF: high fever, severe abdominal pain, chest pain, joint pain, swelling, skin rash on legs, especially shins, and fatigue, malaise. Complication: amyloidosis, deposition of amyloid protein in kidneys, and that leads to renal failure. And diagnosis is based on clinical. Then organ part for guidance and cure. In aphorism number 3, as Dr. Honeyman told, physicians' clear perception. Every individual case of disease, knowledge of disease. First of all, knowledge of disease is important. Then knowledge of medical powers. If he knows how to adapt according to clearly defined principle, what is curative in medicine, what he found morbid in the patient. So recovery must ensure. Then choice of the remedy, then proper dose, proper period of repeating dose. Finally, knows the obstacle in recovery, how to remove them so that the restoration of health is permanent. Then aphorism number 6, unprejudiced observer, means to say that we have to free from prejudiced thoughts, be his power of penetration ever so great, to take nothing in every individual or in an individual disease, except the changes in the health and the body of the mind. Remark by those around him. We have to ask about the patient from the attendants and we have to observe our by the physician. All these perceptible signs represent the disease in its whole extent. That is, together they form the true and only conceivable portrait of disease. Then aphorism number 73. Here, acute diseases attack human being individually. Exciting cause. There are some exciting cause, injurious influences, which they were particularly exposed. Acute febrile affections like excess in food or insufficient supply of it, severe physical impression, overheating, dissipation, strains, physical irritation, mental emotion. These are the exciting cause that cause acute diseases, acute febrile affection, excess of food, insufficient supply, or severe physical impression, overheating, strains, physical irritation. These are the exciting causes acute febrile affection. Now, sporadically, attack several person at the same time here there by means of meteoric or telluric influences. That is meteoric or telluric influences. Then epidemic, there are many person attacked by the similar suffering, same cause. Acute miasm affect persons once in a lifetime. That is smallpox, measles, whooping cough, scarlet fever. As in 1801, Purpura miliaris, which came from West, its prophylactic and curative remedy is belladonna, and in scarlet fever, aconite was given. And then aphorism number 231 to 245, Dr. Honeyman describes about intermittent diseases. Okay, in aphorism number 231, there he told about intermittent fever and non-febrile affection. In 232, there is alternating diseases. And alternating disease belong to the class of chronic diseases in which one more certain morbid state alternated uncertain intervals. Certain morbid states alternate with uncertain intervals, and they are complicated with syphilitic miasm. And in former cases, uh, they are cured by, first of all, they are chronic diseases, psoric plus syphilitic miasm. So first, they will cured by antipsoric medicine, then with antisyphilitic. Then after 235, intermittent fever. They prevail sporadically or epidemically, and every paroxysm likewise composed of two opposite alternating states like cold, heat, heat, cold, or cold, heat, sweat. So in this case, remedy is not just antisoric. We don't have to give antisoric at first. We have to give from the general class of proved medicine, acute medicines like belladonna, aconite, bryonia, restox. Then after, when the acute condition remove, then we have to think of antisoric medicine. And Dr. Honeyman told when to give when he's free from fever must be the chief guide to the most appropriate homeopathic remedy. Then aphorism number 236. The most appropriate and efficacious time for administering the medicine in these cases when there is termination of the paroxysm or the patient in some degree of recovered from effects is given immediately. If it is if it is given immediately before the paroxysm, then it coincides with the natural reoccurrence of the disease and it causes devastation, violent contention. So the remedy should be administered immediately or very soon after the termination of the paroxysm. Then aphorism number 237, if the apyrexia stage is very short, as in happen in bed fever like malaria, septicemia, there is continuous fever, typhoid, there is a stepladder fashion fever, fever increases, but the relaxation period is very less. Then it is given when the patient perspiration stage begins to abate or other subsequent phenomena of expiring paroxysm begins to diminish. Then aphorism number 238, if the return of the same fever after healthy interval, if the same fever return after the healthy interval, then there may be some noxious principle acting upon the convalescent, as in case of marshy region. If the patient is locating some residing in marshy region where malaria is always epidemic, so so for the permanent restoration can often take place only by getting away from this causative factor. That is possible by seeking mountainous retreat if the cause was a marshy retreat. Then aphorism number 240. Here Honeyman told about the specific prevalent epidemic or intermittent fever do not effect a perfect cure in some one or other patient if it be not the influence of a marshy district that prevents the cure, it always the soric miasm. If patient has relocate some other area, still he has the condition of fever come again and again, then there is always a soric miasm in the background. Then in this case, antisoric medicine must be employed until complete relief is obtained. Then epidemics of intermittent fever in situation where none are endemic are of chronic nature. Epidemics of intermittent that are none of endemic are chronic nature, composed of single acute paroxysm, and each single epidemic is a peculiar uniform character common to all individual attack. So in this case, there is homeopathic specific remedy for all suitable cases that is serviceable for all patients who enjoy tolerable health before the occurrence of the epidemic. Then aphorism number 242, epidemic intermittent fever, where the first paroxysm have been left uncured or the patient become weakened by improper allopathic treatment, then the inherent sora that exists in so many persons in a latent state become developed and it becomes soric intermittent fever, so that the medicine which would have been useful in the first paroxysm, really an antisoric, no longer suitable. So this soric intermittent fever generally subdued by minute repeated doses of sulfur or hypersulf in high potency. Then 245, every perceptibly progressive and striking increasing amelioration in a transient acute or chronic disease is a condition as long as it lasts, completely precludes every repetition of the administration of any medicine. Means to say that if there is perceptibly progressive amelioration, we don't have to give we don't have to repeat any medicine after that, because it hastens towards its completion, and every new dose of any medicine, even of the last administered, uh, would in that case disturb the action of previous medicine. Then case, a 2-year old girl having UTI. Her main complaint is high fever, that goes around 102-degree Fahrenheit, with shivering, shaking, and coryza slight since 1 week. And baby's mother told me that she has a hot head, upper body is hot, and the palm and the soles are cold. Upper body hot and the lower body cold, and there are no rashes, and the baby uses diaper because she can't hold for a toilet. So repeated diaper 24-hour using diapers. She told that she had taken allopathic treatment but not relief. Her fever reaching up to 102 Fahrenheit at night. Fever rises in morning at 4 a.m. Thermals chilly, appetite good, thirst increase but in sips, stools normal, sleeping. During sleep, she tosses about in bed due to high fever at night, muttering during sleep, Slight shaking due to high fever, but not convulsions. Urine yellow and normal, no offensiveness. Perspiration normal, but increase after fevers come down. Desire sweets. Then mantles, the baby is very active, playful during day and at night. Uh, and at night become restless, slight low due to high fever, tossing about in bed, jerking, shivering, muttering in sleep. As investigation done before the homeopathic treatment, her hemoglobin is 10.9 gram per DL, that is slight low, and TLC 15.73, and monocytes increase 19. In ESR increase 44. In urine routine microscopy, urine color pale yellow, specific gravity 1.020, leukocyte strays present. Okay, they tell there is UTI. Pus cells increase 20 to 25. Then this is the CRP, that is C reactive protein, is so much high, 134.70. That tells the highly infection. Okay, and these are the reports: CBC 10.9 and ESR 44. Monocytes increased, and this is a urine report, urine routine and microscopy. Leukocyte strays detected, pus cells detected. Then, according to the provisional diagnosis, urinary tract infection due to continuous usage of diaper plus leukocyte strays present. And after analysis, I prescribed on the basis of PQRS, that is the peculiar symptom that I found: head hot, palms and soles cold, upper body hot and lower body cold, tossing about in bed constantly, changes place to place, muttering during sleep. Prescribed basis on the PQRS, that is Arnica 200. Okay, and before giving Arnica, I had told her to note the temperature before giving. So at 12 p.m. During day, the temperature was 100 degree Fahrenheit. At 2 p.m., Arnica was 200 was given. So on the basis of minute sufficient doses, according to the aphorism number 272, I have given in 100 ml of water, one medicated pill, then just to drink 5 ml. Instruction to the parents: too early give Fahrenheit 6x if temperature goes above 100 degree Fahrenheit. If not, if temperature is below 100 degree, no Fahrenheit 6x. But if temperature above 100 degree Fahrenheit, then give Fahrenheit 6x too early with sponging. Note the temperature at 4 p.m., 8 p.m. and don't give further dose of Arnica 200. If temperature rises, do sponging and give lots of water. Then after observation, giving medicine, temperature at 4 p.m. Now the Arnica had taken around 2 p.m. Arnica had taken at 2 p.m. noon. Now temperature at 4 p.m. 96.62 Fahrenheit. At 5.18 p.m. 98.4 Fahrenheit. At 6 p.m. then temperature start rising 100.9 degree Fahrenheit. So Fahrenheit 6 given 1 hourly till 11 p.m. from 6 p.m. Next day morning at 9 a.m. around 9 a.m. temperature was 98.42 degree Fahrenheit till 1 p.m. Then after there is no fever. So after that baby gets well, fever not occur till further, and the continuous 1 week high fever with slight shaking the baby recovered only in 2 days. No tossing, no muttering. Then same baby girl after 2 years in school, a viral infection, that is in school, there was spread a viral infection called hand, foot, and mouth disease. And that time she has cold, cough, sneezing, lot of sneezing, feverish feeling on and off with rashes. Okay, slight rashes in foot, palms, around angle of mouth, and stuffy nose at night. Cough, slight mucus, but rattling sound. After investigation, it was found the disease uh, said to be hand, foot, and mouth disease is spread in school. Small children up to 5 years old. Then thermals hot, appetite good, thirst increased in sips, and stool normal, sleep normal, but hot on touching, urine normal, perspiration normal, mental generals. Child is active but slight restless at night. Then no investigation done, as it is self-limiting viral illness, taking 2 weeks to recover. After analysis of case, it is found to give Restox 200 given, as there is rainy season, and there is eruptions with fever plus restlessness at night. The baby can't be in bed at night. She roams around the home, and advise lots of water to drink. Apply coconut oil on rashes. Avoid exposure outside to stop the spread of viral illness. And important to check the stool color and urine color. Waiting for 3 days after giving Restox 200. I have wait for 3 days. Meanwhile, I have given Ferrum 6x twice a day, as there is not much fever. Coryza get well, and there is slight cough, slight sneezing, no fever, rashes dried up. Takes 4 days more. Within 1 week, baby gets well. So homeopathy works so good in small children. Many parents fear to give homeopathy in acute cases. Then, according to aphorism number 2, the highest ideal of cure is rapid, gentle, permanent restoration of health or removal and annihilation of the disease in its whole extent in the shortest, most harmless way on easily comprehensible principle. And according to aphorism number 153, more striking, more singular, more uncommon, peculiar characteristic sign and symptom of the case of disease are chief and most solely to be kept view. The more general and undefined symptoms like loss of appetite, the general symptom, the more general, headache, debility, restless, demands little attention. But if we found a striking, singular, uncommon symptom, like in fever, if there is no thirst or uh, chill with thirst, so like these are the striking, singular, uncommon, peculiar symptoms. Aphorism number 272. In no case is it request to administer more than one single simple medicine at one time. It is important to give only single simple dose. If we mixed one remedy with other, like if we give belladonna after that aconite, so the we can't get the result so fast as compared to a single medicine, because in acute cases too it takes 2 hours, more than 4 hours, but it works. But if we mix a few medicines together at once, it just harm to the case, and it goes to another allopathy. Then hand, foot, and mouth disease. Hand, foot, and mouth disease is a common viral illness that usually affects infants and young children, caused mainly by Coxsackie virus A16 or enterovirus 71. Both belong to the enterovirus group. Is spread through direct contact with saliva, nasal drop, and blister fluid, stool of an infected person, contaminated surfaces or objects, Symptom usually appear 3 to 6 days after infection. Fever, often the first sign, then sore throat, malaise, feeling unwell, painful mouth sores, small red spots that turn into ulcers, especially on tongue, gums, inside of cheek, skin rashes, flat or raised spots, sometimes with blisters on palms of hands, soles of feet. Mainly the skin rash is found on mouth, around the angle of mouth, lips, and palms of hands and soles of feet, occasionally on buttocks, knees, or elbow. This is the picture of the baby. I have clicked. There are eruptions, that is bulbar eruptions in the foot, blister-like eruption in hand, foot, around mouth, mucocutaneous junctions, chin, even in the oral cavity also. Then course of illness, usually mild, resolve in 7 to 10 days. Complications are rare, but EV71 infection can sometimes cause aseptic meningitis and encephalitis, polio-like paralysis. Advice to parents: encourage fluids, cold milk, soft food, avoid spicy, acidic items, frequent hand washing with soap and water, avoid sharing utensils, towels, or toothbrushes, disinfect toys and surfaces, keep infected children home from school, away from school, until blisters have dried and fever subsides. Then a case of periodic fever with eczema. A lady, age 61, complaining fever since 2 days after in sun. She told me about at noon, 12 p.m. She went to listen bhajan. She sat there in open area for 1 hour in sun. So then there is sore throat, coryza, then fever. Past history: she has thickened, itchy plaque over patch on right lower anterior of leg since 8 to 10 years back, in which itching increases with acidity. Patient told me when there is gas formation or there is heartburn or there is acidity, she wants to itch that oval patch, and that skin complaint increases. She has fever for 2 to 3 days. Patient thermal chilly. She is so much chilly that she can't even in front of a fan. Even she wants to use a blanket during night, during rainy seasons. Appetite decrease, tongue coated yellow and dry, thirst increase in small sips often. I prescribe her on acute complaint, that is fever, sore throat due to overheating in sun, and coryza aggravate indoor. So I give her Rs 30 OD, 2 doses with Ferramphos 6x SOS if fever goes over 100 or 100 on 14 March 25. Then after 2 days, she told me fever has gone, but sneezing is much, always feels chilly. So I wait for 2 days, then I change the remedy, Econite 31 dose. She gets well after 2 days. She don't have fever in May. There is no fever in May. She visited me on 17 6 25. Then that time I have given her Nux vomica because she complains of gastric pain, wants to vomit. Uh, then on 16 August 25, she comes with feverish feeling, not fever, feverish feeling with chilliness, better by covering. I repeated the medicine RCL 200, 1 dose. Then in September, she has no fever but skin complaint, itchy, hardened patch, which increases with acidity. Then I give SL30. Then in September 8, 9, 25, fever starts. In September, fever start with shivering. I again given ourselves 200. Then in uh, October, skin complaint is less. Watery discharge from nose with headache, no fever, Rs L 200. Then in November, after 14 November, after giving medicine for her acute problem, feverish feeling, little relief in skin complaint, as I asked her about that patch, so she said itching is less. So physician's observation, according to my observation, patient looks dull, mild, and yielding and exhausted. Every time she says yes, this happens, means to say that she wants to please me, says yes, yes. That is yielding nature. As I asked her about her occupation, she's in teaching occupation, but left 10 years back due to family. Everything is good, but she told me about her daughter's marriage is not going well. I asked, is she worried about her? She said she don't think much, but her daughter always called up at night and want to share her problems with me. But I want to sleep. So I told her, don't call me at night. So she just want to get rid of her daughter. She told me she don't want to listen her household's complaint. So there is indifferentiation to her daughter's problem. Her skin complaint started years back after working in water when washing clothes with washing powder. After she also told me that after taking boiled milk, usually when she takes boiled milk, her gastric problem increases. There is feeling of nausea after eating, and the itching in the patch also increases. Cracks and dryness in both palms with itching, and there is patch on the right anterior lower part of the leg. Itches more when acidity increases. Scratching causes slight bleeding. Aversion to boiled milk. Tongue yellowish coating, thermals chilly, and she's so chilly that she don't want fan in rainy season. And even she used blanket when no one uses blanket. Can't sit behind a fan. These are the patches on her lower leg and in palm. And shows me her all investigation done 2 months back. Those are normal. And after analysis of case on 14/11, I have given her CPR 200 OD 1 dose. Now I have to wait for 1 month at least, as according to aphorism 246, the slowly progressive amelioration on a very minute dose whose selection has been accurately homeopathic with no hindrance to duration. It accomplished all good in a given case in period of 40, 50 or 100 days. So wait and watch and patience is the main key in homeopathy. Now, some rubrics regarding fever. In Kent Repertory Mind chapter, muttering during sleep, that is Rustox 2 plus, Hyoscyamus 2 plus. And in Mind chapter, anxiety, fever during aconite, Ambragracia, Ars, Brightacab, Ipecac, Sepia. Mind chapter, excitement, fever during night at sulfur. Mind indifference during fever, that is conium 3 plus, opium, phosphoric acid 3 plus, arnica 2 plus, pulse 2 plus, and sepia 2 plus. Then in Kent Repertory, chill chapter, afternoon, heat following, nux vomica 1 plus, pulse 3 plus, and chill chapter, afternoon, violent chill with thirst, red face, that is with blushing. Violent chill and thirst, that is param 3 plus, fever chapter, heat in general, chilliness with apis 3 plus, rs 3 plus, and fever anticipating. There is single remedy, nux vomica, and inflammatory fevers, belladonna, bryonia, murk, pulse, and rostov. Perspiration chapter, night with locucity, that is pulse, perspiration, conversation from, that is one remedy, that is ambragracia. And then few medicine in cases of acute fever, aconitum naples, that is monkshood, and family Ranunculaceae. There is dry skin, violent thirst, full bounding, frequent pulse, and sweating reliefs, aggravation from dry, cold winds or chilling of the body after overheating. When patient uh, go into the sun and overheat there, then after coming to home, just sit in AC.
It's Dr. Rajita.
Oh,
Rachita, it is just 5 minutes remaining, so it is better to have a session on material medica later.
okay.
Okay, you can close the video, and then you may open the video now. Once you stop this, you can open now.
Actually, sir, my video is not opening.
Now you may try once again. Now it can possible because yes, there is some fog like thing is coming. Okay. If you want, you can join from phone so that we can see you.
Okay, sir.
Please join now. Yes, a fever is one of the biggest challenge for every homeopath. And
Yeah.
when you
Hmm.
in your practice, because people believe that fever is a thing that may goes into a febrile fits, and sometimes that patient may have some problems later on. So frankly,
Yes, sir.
but the thing is that most of the people don't know what is fever. That's the reason
Yeah.
why they are struggling.
Hmm.
And when you, for example, when you get a fever, why this temperature comes out? When we can explain this in layman's language. It's like
Yes.
anything. You suppose your body has, unfortunately, people don't know why these people, we, we doctors are doing blood tests. When you look at the blood test, you can see the WBCs. They are
Yeah, sir.
they are waiting for the enemies to come over, and there are just we have policemen, and then army men, the polymorphs, the so-called
Hmm.
men, and lymphocyte, the so-called police people, and the eosinophils, the so-called hunger.
Hmm.
These people are waiting there. So once
Hmm.
an attack, one a foreign enemy is coming over there, these people try to have a war with them, and as a result, they may try to
Hmm.
kill the enemy.
Yes, sir. There is
And
reaction, antigen and antibody reaction
yes,
that
yes,
causes.
once this happens, as you know, whenever there is a war between any two countries,
Hmm.
naturally there will be temperature. Temperature
Hmm.
of the nation will be very high, and
Hmm.
that's the same happened with the person also, and the
Hmm.
temperature comes to
Hmm.
the external part that we feel as temperature. Oh, it is a bad sign,
Hmm.
but actually it is a big good sign. That means that the body inside the persons who are there inside your body are
Hmm.
trying to eliminate the enemy. And
Hmm.
so, unfortunately, people don't know why these are coming. They fear that the fever is a bad sign. Though, no, fever itself is a good indication. But how a homeopathic doctor need to look into the fever? That's the biggest challenge because
Hmm.
it is not the thermometer that can detect the if you look at a patient, you
Yes.
use your both hands for finding what the temperature is there, whether the temperature is the head, or whether the temperature is on the leg, or whether it is on all part of the body. You can
Hmm.
differentiate accordingly. If a person comes up with the patient, come up with the temperature all the body, you can just go ahead with those remedies that covers that. That method, and some of the patients may have heat on the head and the cold feet.
Yes, sir.
So some people, for some patients, you may have fever in the abdomen, temperature in the abdomen only. So you can go in that way. So the physician hands are the biggest, the better than the thermometer that we
Yes,
people
better
use.
than thermometer.
So well, then people used to come, oh, doctor, my baby has having fever yesterday, 100. Then I give her a dose of paracetamol like that, something from allopathic side. And now you see the doctor it is 104 like that. But if
Yes.
you look at a case of a patient who is not taking that kind of medicine and they are taking homeopathy, it will not go all of a sudden 104. Normally, all viral fevers may subside within
Within 4 5 days.
48 hours. The temperature may come out, and if there are enlarged tonsil or something sinusitis problems in the patient, it may go for some more days, but not full time. This is what we have to look, and this is how a homeopathic doctor need to look into cases. Anyway, I am inviting Dr. Ambaresh sir to say vote of thanks to the session as the time is about to finish. Yes. Or it's not, oh, I cannot see you. So, I mean,
Actually, sir, my phone is
I mean,
having low battery, and next
yes,
time I will prepare well for that video.
I am,
Uh,
I'm inviting Dr. Indian.
Yeah,
Yes.
yeah. So, yeah. Am I audible, sir? Yeah.
Yes.
Actually, I'm on a data connection, so the video is not on. Kindly excuse me for it. Yeah, Dr. Rachita, I joined late, but you have selected a very nice topic, and you have also
okay.
explored.
Thank you, sir. Thank you.
Yeah. And we really appreciate that you have taken many pains to do this presentation. So,
Oh,
on the behalf of IFPH team, I would like to say a vote of thanks to you for a good presentation. And
thank you, sir.
because of time, we lacked in the materia medica. So we'll request you to once again have a materia medica section of the drugs for fever. This is a very
Sure.
difficult
Next
topic,
time I
but
will
yeah.
prepare the materia medica part for.
Very nice. Yeah. But you have chosen a very nice topic, and it is a challenge
Actually,
for
sir,
homeopathy.
fever is not a basic common topic, common,
Yeah,
but
very common.
we homeopath, some homeopath just mix the remedies and giving, but I have
Yeah.
to work upon the single remedy and how single remedy cure the acute case in just 2 days.
Yeah, very true, very true. So it's a very nice topic. We would like to hear you again. We are really
Okay.
thankful from the forum of IFPH and also the audience who have attended this. We will once again,
Okay.
as per time, we will meet again. So thanks for
Okay.
your
Sure.
session.
Sure.
Yeah. I'll hand over to Dr. Dhanesh, sir. Sir, kindly hand over take the session. Yeah.
Thank you, Dr. Nandani Bhavadkar, and those who attend the session. And once again, we are congratulating Dr. Rachita Tripathi for coming over here. Even though she is coming here for the first time, she has done a beautiful presentation.
Thank you, sir. Thank you.
Congratulations once again, and thank you once again. And tomorrow we will have a session from Dr. Shashimo and Sharma from UK, and Doctor will be talking about some of his clinical experience. That he's always coming over here and presenting his cases. That's what regularly sir used to do. And with that, we come to the end of the day, 1902. Over to Dr. Maria Majon. Thank you all.